And I have the honor to invite Ms. Tlalit Tzure, the Vice President of Business Development and Global Marketing of IceCure, which operates in minimally invasive field to improve the quality of life of many breast cancer patients. Please, Tlalit.
Thank you. I will just share my screen. Okay, so can you all?
F9.
Can you all see my screen?
Yeah, just make it F9. Great.
Okay, so thank you, Jackie. Thank you for all the organizer for this amazing webinar series. Thank you for inviting me to speak and share about the IceCure technology and the innovation. So IceCure is all about freezing cancer in its track. We are doing cryoablation technology, enabling a non-surgical in-office treatment to treat both benign and cancerous tumors. As Jackie said, my name is Tlalit. I'm the VP of Business Development. I'm responsible to search on a constant and daily basis, search IceCure global and strategic partners around the globe to help us deliver our technology and message around the globe. So IceCure was founded in 2006 under the goal to set a new treatment for both benign and cancerous tumors, offering a minimal invasive solution in order to avoid surgeries in patients that have a specific conditions of benign and cancerous tumors in multiple applications. The main innovation was to come up with a solution that will make breast cancer patients, women, avoid surgery, avoid the hospital stays, carrying, and also a painful surgery that usually takes the lead to another surgery of a reconstructive plastic surgery. So our flagship product is the ProSense, in which we use to treat, like I said, benign and malignant tissues in the breast and other applications. We are offering a minimal invasive, safe and cost-effective treatment for tumors that can be done in an office setting outside the hospital or in a hospital under the imaging room. Our mission is to become the new gold standard for cryoablation therapy by providing a superior, safe, fast, and cost-effective, minimally invasive treatment, like I said, for taking a very low temperature, using liquid nitrogen in order to freeze the tumor. By freezing the tumor and reducing the temperature up until minus 170 Celsius degrees, we are destroying the tumors. And no tissue can survive in such a low temperature, so we destroy the tumor. We are doing that under imaging, so we can see that we are growing an ice ball cover the tumor and without affecting the healthy tissue. So we are able to destroy the tumor, take the patient home at the same day. The procedure is very quick. It takes no general anesthesia, no scarring, no hospital stay, and the patient can resume to full activity in the same day. You see on the screen this process. Since a system, it includes a capital, which is the console, and consumables, which are the probes that are inserted into the body. The procedure, like I said, is performed under imaging. If it's a breast application, then it's done under ultrasound. And if it's interventional radiology application, then it's done under CT imaging. So once the physician is seeing the tumor, he knows what kind of probe or consumable he has to choose according to the size and the shape of the tumor. Then the probe is inserted into the tumor. We use liquid nitrogen in order to generate a very low temperature to turn the tumor into an ice ball. We are doing 2 cycles of freezing. Again, depends on the size and the shape of the tumor and the location. That will determine the period of the freezing. For example, for breast cancer, we do 2 cycles of 9 minutes freeze each time. For a kidney, we do a 12 minutes freeze each time. And then after 2 cycles, we take the needle outside of the body. The adjacent healthy tissue is left undamaged. And there is a physiological process that makes the tumor absorbed by the body within a couple of weeks until a couple of months. And the patient, like I said, can resume full activity at the same day. It doesn't have to stay in the hospital. We are using a very strong technology backed by many patents for the needle that we use, for the technology, and how do we turn the liquid nitrogen into such a low temperature, and through the whole technology. We have a wide range of regulatory clearances. We have an FDA, we have a CE. We also have approvals for the technology in Hong Kong, in Thailand, in Singapore, and in countries in South and Central America. We have also gained the Indian regulatory approval 2 months ago, which is the exact reason why I am here today, because finally we can also offer our innovative technology in India, and we are able to perform a cryoablation for cancer tumors also in India. So what are the benefits using IceCure technology versus, like I said, surgery? First of all, for the patient, we are offering a non-surgical procedure, very fast, quick one. It doesn't cause pain, it doesn't leave a scar in the body, and the patient can resume full activity very quickly. For the physician can also benefit from a very quick procedure that allow him to see more patients over a day. The system is very intuitive and easy to use, and of course, it makes it very simple to schedule a couple of procedures over a day. And also, the fact that the breast procedure can be done in an office settings allow the physician to earn a completely new revenue stream, because he now can perform such a procedure in his private clinic. For the insurer and for the healthcare provider, of course, we are saving a lot of money because we are using a cost-effective procedure, which is much safer and saves money over a surgery, no complication, no long hospital stay. It's done in the office. The recovery, like I said, is very quick, and also the material that we use, liquid nitrogen, is very cheap and available everywhere. Every hospital uses liquid nitrogen in IFU, in many labs, and also in the OR, so it's very affordable and available to use. We are using a small cans of liquid nitrogen, so also no need for a complicated infrastructure for storage or for using the system. So benefits for all stakeholders. We are treating a wide range of application. Like I said, in the breast, we can treat benign and malignant tissue. This procedure can be done by the gynecologist, by breast surgeons, or by a breast radiologist. What they need to know is how to use an ultrasound, because like I said, the procedure is done under ultrasound imaging. In the interventional radiology spec, we are treating kidney cancer, lung cancer, bone cancer, and very soon also prostate. We have a clearance for prostate, but we are now developing our next tool, so it will be available within the next year. There is also a new era developing, which is the combination between cryoablation and immunotherapy drugs. There is an evidence in the literature showing that using cryoablation actually makes the immune system of the body works in a better way, and it enhances the immune response of the body. That will be the next era. There are a couple of clinical studies done right now to show the great result with this combination. So it is our anticipation that within the next few years, this will be the new trend. This is an example of office-based procedure for a breast patient. You can see that it's done in the doctor's office. He is able to view the tumor and the imaging with an ultrasound device, and he's able to perform the procedure by himself. Like I said, an office setting, very simple and easy to use. This is pictures taken from a kidney procedure done under a CT imaging, so it's done in the CT room. Again, we are using a single probe inserted into the tumor, and then we visualize the image and the growing ice wall under the CT imaging. And both the system and the doctor are very easy to handle, and the doctor can perform the full procedure by himself. And now let's talk a bit about COVID, which you all, the previous speakers have mentioned. And like Jackie said, the COVID has brought very bad things to our life, but it's also brought good things. We are seeing during the last few months like surgeries have been canceled or delayed and caused many cancer patients around the globe to get into a serious condition. We are able to offer a minimal invasive solution to continue to treat the breast cancer or other cancer patients outside the hospital setting or outside the operating room. So we are able to keep them safe from the COVID infection, and at the same time continue to give care for cancer patient. As we know, we cannot stop cancer because there is COVID. So we are able to continue the treatment to cancer patients. We are able to offer a reduced demand on the emergency room, on the operating room, because we can both continue the care outside of the, let's say, infected areas in the hospital. We're able to keep patients outside the hospital and at the same time give them the treatment they need for destruction of tumors. And we have seen, like I said, demand during those months, and we have also adjusted to working remotely. Those are pictures from a customer of us in Johannesburg, South Africa. He really wanted to implement and start working with our system and start treating his breast cancer patients during the COVID pandemic. So we have come up with new marketing, training, and remote tools in order to be able to install our system and support our customer remotely. This is Dr. Shub, breast radiology in Johannesburg. He has gone through our remote training, and he's now treating breast cancer patients by his own at his clinic in South Africa. And we are proud to say that we were able during the last couple of months to support new customers around the globe, to support them in remote installation, remote training, and also through live procedure to be able to get a cryoablation treatment for cancer patients around the globe in such a dramatic time of COVID. So I invite you all to come join this revolution and start offering an innovative treatment for cancer patients around the globe. Like I said, the technology is now approved for treatment in India. We have now have a new distributor in Delhi. The company is called Sony Impex, and I am now searching for additional distributors and a representative around across India to help us deliver the best of care for cancer patients across India. this is the global acceptance of IceCure technology. We are working in Asia, we are working in Europe, we are working in the US, like I've mentioned, South Africa, soon also in China. We are now going through registration in China, and hopefully very soon we will be able to start actually treating cancer patients in India with our technology. And that would be from my side, and I'm happy to answer any questions that might be from the audience.